So Dr. Calac went to Harvard Medical School and completed the University of Southern California, Los Angeles County Combined Internal Medicine and Pediatrics Residency Program. He is board certified in both internal medicine and pediatrics and is board eligible for hospice and palliative care medicine. He's a member of the Palma Band of Louisiano and Indians and is actively involved in the community. Dr. Christian Ramers is the Assistant Medical Director for Research and Special Populations at Family Health Centers of San Diego. He received his medical degree at UCSD, completed a combined internal medicine and pediatric residency at Duke University, and an infectious disease fellowship at the University of Washington Medical Center. There, he also got a master's degree in public health and built collaborations from Seattle, Albuquerque, Tanzania, Mozambique, Angola, Namibia, Cuba, and Guatemala. He specializes in infectious diseases and oversees clinical programs in HIV, hepatitis B and C. Dr. David Lowe is the Senior Associate Dean for Research at the University of California, Riverside School of Medicine and a Distinguished Professor in the Division of Biomedical Sciences. He received both his medical degree and PhD from the University of Pennsylvania. He is the director of the Center for Health Disparities Research, as well as the BREATHE Center, also known as Bridging Regional Ecology, Aerosolized Toxins, and Health Effects. Alec Calac is an MD PhD candidate at UC San Diego and San Diego State in the Joint Doctoral Program in Global Health. After graduating with a bachelor's degree from the University of Arizona, he completed a fellowship at the NIH and was also appointed to the Tribal Youth Health Advisory Board at a DC-based nonprofit. With research interests in misinformation and vaccine hesitancy, he works tirelessly to promote strong public health messaging on social media. He also leads the UC San Diego Association of Native American Medical Students and will follow his father, Dr. Calac, our other panelist, to be the second person from their tribe to become a physician. And finally, moderating tonight's discussion will be Dr. Juliet McMullin, co-director for UC Riverside Center for Health Disparities Research and the center's lead for the Community Engagement Core. She received her PhD in social sciences from UC Irvine and completed the UC President's postdoctoral fellowship at UCLA. She specializes in cultural and medical anthropology, exploring the health experiences and well-being of Indigenous communities. She is also the director for the Medical and Health Humanities PhD and MD designated emphasis and is the chair for the new minor in Medical and Health Humanities Studies. Thank you also to Olivia Ramos Cruz and Jane Samaniego for helping to keep things running smoothly behind the scenes. And thank you to Patricia Chavez and Cecilia Ibarra for helping with the live Spanish interpretation. So to kick things off, after this introduction, we're going to have some brief poll questions to get a sense of who's in the audience and what you all are thinking. Then we'll dive straight into the Q&A with everybody. So please submit your questions to the Q&A box. And if you stick around to the end, we'll be drawing 5 random names to win $25 e-gift cards and have a list of other resources for follow-up. So first, we're going to have our poll questions. Hold on. Here we go. So feel free to click on whichever response is appropriate. It asks, have you or will you get the COVID-19 vaccine? And we'll give this a couple more seconds. If you want to get your vote in there. Great. So it looks like a lot of you have already gotten the vaccine. Our next question, do you currently wear a mask indoors or outdoors when it's not required? So we know that the guidance recently changed, but we want to know, do you still wear a mask indoors or outdoors when there isn't a requirement to do so. Looks like there's a lot of different responses this time. A few more seconds for a few last votes. And our third of 4 questions. Which of the following places do you feel comfortable visiting right now? Mark all that apply. This is good. I see people have a lot of opinions. All right, a few more seconds for a couple last clicks. As you can see, it varies widely. The grocery store seems to be the one that most people are comfortable with. And for the last question, it asks, I feel comfortable spending time with the following people, even if they have not gotten the COVID-19 vaccine, and mark all that apply: family, friends, coworkers, or classmates. So that's the first half of the question. The second half below, I feel comfortable getting help from the following people, even if they have not gotten the COVID-19 vaccine, mark all that apply: employees at businesses like the gym, beauty shop, repairman, or healthcare staff, doctors, nurses, technicians, or other first responders like firefighters, police, ambulance. And you can choose more than one, depending on who you feel comfortable getting help with or interacting with, even if they have not gotten the vaccine. Yes, so there's a question of, can you choose none? So if you don't mark any, then it means you don't feel comfortable with any of them. Oh, it wouldn't let you submit if you didn't want to mark any? Okay, then we'll take that into account. Still little things about Zoom we haven't quite learned yet. Okay, if you wanted to mark none, you can just add it to the chat, and then we'll make note of that as a none of the above. It seems that we have a few people who are putting none of the above for, and you can specify for which ones. None of the above for both, or none of the above for the first one or the second one. And quite a few people are responding that way. That's good to know. And we will show you the results. So it does vary, and keep in mind that there are a number of people who have put into the chat that they feel comfortable with none of the above, whether it's for the first half, the first group of family, friends, coworkers, or the second group in terms of business employees, healthcare staff, or other first responders. So this will be a great way to start our discussion. And I will turn it over to Dr. McMullin to help guide our discussion with our panelists.
Thank you so much, Mona. We really appreciate all the work that you've done to organize this panel. I know that we have been doing some focus groups in Riverside and San Bernardino counties with our Native American communities. And one of the biggest things that they said is that they wanted to have more town halls, getting more information out to our communities. And so even thinking about that first question, knowing that most everyone in the audience has had their vaccination, it's still this question of how do we talk to our friends, our relatives about the vaccine and how we can move that forward. So welcome again to the panelists. And well, to get this started, we'll have a relatively easy question. Do I still need to get the vaccine if I've already had COVID-19? So if you've already recovered from it. And I guess we can start with Dr. Calac.
Yeah, thank you. And I just want to thank everyone for their great efforts. And of course, my local colleagues at UCR and down in San Diego. And of course, my son, Alec, for joining me on this this platform. So I've been there at my facility at Indian Health. And so for the audience, for those who do not know, it's northern San Diego County. It's about 40 miles northeast of where Dr. Ramers is. And I serve about 5,000 to 7,000 American Indians in our population. And it's a question that comes up quite a bit because we've had, for a variety of reasons, individuals who were very hesitant in getting the vaccine initially. If you were 50 and over, if you were 50 and younger, if you were 50 and over, you lined up pretty quickly. And we had several mass vaccination events, and those were very, very popular for the 50s and overs. But the 50s and youngers were not as adamant or involved in getting the vaccine. So to the question, should you continue to get the vaccination? So I want to give props to the audience and of course people who are responding and in that complimenting them on their flexibility, because the flexibility in adapting to the new changes in rules and regulations around getting vaccine has been daunting at the very least. But in terms of getting the vaccination, yes, it is recommended you continue or do you get the vaccination. The recommendation was at least 3 months because you have enjoyed some natural immunity. But at some point thereafter or shortly thereafter, the 3 months, then you would benefit from the vaccination. And it's important to realize I'll let Dr. Ramers speak a little bit more about this, about some of the research that is still coming out, and it's still an unknown entity in terms of the capacity for the human body to provide protection thereafter. So I think any protection would be in everyone's best interest and their best health moving forward.
And I can add to that a little bit. Thanks, Dan. So there's a couple of reasons why it actually is really important to still get vaccinated after you've had COVID. And part of it is because of all these variants that are starting to come around. The virus is mutating, it's changing, it's what viruses do. And we've seen some really dramatic historical examples of entire communities being infected at very, very high rates. In particular, I'm thinking of a Amazon community called Manaus in Brazil. 60, 70% rates of infection early on in the pandemic. And people thought, well, they're finished, right? They're all protected, they're all immune. Well, actually something very unexpected happened, which is the Brazilian variant, or the P1 variant, now called Gamma, came in again and actually infected higher numbers of people. And what we learned from that is that the natural immunity that somebody gets from having COVID is not really that good, actually. The body is in a situation where the virus is interacting with the immune system. It's chaotic. It's not a very controlled environment. In fact, the immune system gets really out of control during a lot of COVID infections and doesn't develop a very good and long-lasting response. So we do see reinfections after people have had COVID once already. And it's now becoming quite accepted that vaccine-induced immunity is better than natural immunity. And actually the best, even better than either of those two, is something called hybrid immunity. A local scientist named Shane Crotty just wrote an article about this in Science magazine, that if you get COVID and then you get a vaccine later, you're probably more protected than anybody, actually. So for anyone that has had COVID, I would recommend absolutely getting the vaccine. You don't really need it right away, as Dan mentioned. You could wait a little longer if you want to. But generally, after you've recovered from the initial COVID, then yes, you are eligible to get vaccinated.
Alec, Calac, did you want to add?
Yes, of course. Thank you so much, Dr. McMullin. From the social media perspective, and spending a year kind of in front of my computer on platforms like Twitter, Facebook, Instagram, TikTok, this kind of education about what COVID can and cannot do to you was very prevalent when thinking about the kinds of misinformation that is so prevalent on those platforms, and it's not being readily removed, and it's being shared so quickly. And in all of that, there was actually periods of time where we were seeing groups of teenagers or young adults going out and trying to be infected, and then coming into like host parties just so they could share infection, so that they could acquire this immunity to COVID-19. And as Dr. Ramers and Dr. Calac mentioned, it's really unclear how long the immunity from infection lasts, and it's much more durable for your immune system to have a COVID-19 vaccination, which have been demonstrated to be highly efficacious at not necessarily stopping you from getting infected, but from preventing a severe course of disease and keeping you out of the hospital. So my point really here is, if you see something online, report it, don't interact with it, and make sure that you're flagging it to the appropriate party.
Thank you for that. I'm wondering, Dr. Lowe, if we could add a question from the audience to this conversation. It's sort of similar. They're asking what vaccine is better to receive if they've had COVID and they're still experiencing symptoms.
Well, some of the experience has been, there isn't necessarily one vaccine that's better than the others, but some of the experience has been that people who have long COVID and lasting symptoms, significant proportion of those who've gotten the vaccine see a reduction in symptoms. And it may be because it's activating additional components of the immune system. So I know that one of the things that Alec said that was really useful is that what we don't yet know, what we suspect is that after infection, the lasting immunity may not be as long lasting as what you would have with the vaccination. And so think of the vaccination even after COVID as a booster shot that not only promotes stronger response from basically a couple of different arms of the immune system, the cellular and as well as the antibody response, but also longer lasting memory responses. And so all of these act both in terms of reducing symptoms from people who have the long COVID, as well as the resistance, not just against reinfection, but also better resistance against new variants that are coming out, because you have both arms of the immune system to benefit.
Great, thank you. Along the same lines, a lot of people are really concerned about the new Delta variants, wondering if they're more contagious than others and if they should actually be vaccinated more often because of the new variants.
Sorry, I can echo what some of our scientific leaders have said, which is that the vaccines have been holding up really quite well against these new variants. And again, there's something just different about getting immunity from vaccination. It's a controlled environment. Lots of different, the immune system is a very complicated and beautiful thing. And we have B cells and T cells and natural killer cells and all these different arms of the immune system. I really think of it almost, I hate to use the term, but it's almost like a military. We've got soldiers and generals and all these different weapons that our bodies use to defend ourselves. And when you get vaccinated, a lot of different parts of that entire system adapt to that vaccine and are able to provide very, very good protection. The latest that I saw was specific to the Pfizer vaccine, that it actually prevents, it has 88% protection against the Delta variant of getting the infection and 96% prevention of getting hospitalized, which is actually very, very high and very good. So at this point, we don't really think people need to get repeated vaccinations through time or boosters. There was the companies that make the vaccines put out press releases saying, of course, everyone's going to need boosters, but I don't really think that's necessarily true yet. Maybe certain segments of the population, everybody is completely different and everyone has a completely different immune system. And so maybe people that have that don't have as good a response, or maybe people that have immunosuppression may need boosters. But the general public, I don't really see that happening at this point. We learn new things every week with this virus. But get the regular series, 2 shots for Moderna and Pfizer, or 1 shot for Johnson & Johnson. And you really should be quite protected even against the new variants.
Great, thank you for that. A lot of people are also concerned or thinking around how community cases are lowering. Do they still need to get a vaccine if the number of cases are just decreasing? Dr. Lowe, did you want to?
Yeah, that's an important question. The concern about the Delta variant, for example, is that number one, an importance is that it's more contagious than the earlier versions of the virus that have been going around. And so that's important because if not everybody's been vaccinated, then the high infectiousness, high ability to spread from one person to the next becomes even more important with new variants that are more infectious. And so that actually increases the importance of everybody getting vaccinated. So even if you think the rates are going down and many or most of the people in the community have been vaccinated, that is basically suppressing the brush fire that we have now, but you still leave some fertile, I would say maybe not fertile is not the right way to put it. You still leave some susceptible people in the community, so that if you have a more infectious variant that comes out there, it can just spread like wildfire once again.
So that's one of the attendees was asking about now that there are more variants, if people aren't getting the vaccine, then are we just doomed? What they said, are we just doomed and no one's going to have any immunity to any of it? Is that a version, your response, or Dr. Calac?
Yeah, that's actually, it's a great question, because it's very sensical, right? It's very logical. Like, why would I need to get the vaccine? And just to kind of play the devil's advocate, why should I get the vaccine? If I came on the panel and I said that I am a physician and I did not get the vaccine, that would be a little bit thought-provoking, to many audience members or people who were considering the vaccine. So I did get the vaccine, and I kind of liken it to a contextual environment where people where it's more relatable. So, for example, seatbelts, right? So I think this has been used many times. Like, why would you wear your seatbelt? And this is similar to the vaccine question. Is you're getting the vaccine to not only protect yourself from, as Alec had mentioned, from getting hospitalized and potentially have the risk of death, but also the same argument applies to the use of seatbelts. And so you're more than likely not going to get into an accident every time you get behind the car, but there is a 1 in 200 chance every time you get behind the wheel that you could get into an auto accident. And when you have your seatbelt on, the fact that you're not going to get more seriously injured and possibly die from an auto accident, if it's severe enough, that is mitigated by the use of the seatbelt. So I think the argument about getting the vaccine and being protected and protecting those around you, the ones you love, is a very strong argument when it comes to contextualizing how important it is and how efficacious it is effective it is in those broader contexts.
Great, thank you. You know, there's so much going on right now, kinds of information that we're getting from the vaccines, from the variants, but even masks. And so, you know, there are a lot of public places that are open now, bowling alleys. You know, do we need to be wearing masks there? California just said we didn't need to be wearing masks. And then also, you know, now with the Delta variant, one of our attendees is asking, saying that who is encouraging fully vaccinated people to continue wearing masks? So Dr. Ramers wanted to respond to that.
Yeah, I think the way to think about this is that these are all different tools with different effectiveness, and we don't need to just use one tool. For example, to take the car analogy, you know, we have seat belts, yes, but we also have airbags. And we also have really good brakes, and we now have computers that tell us when someone's about to crash into us. And so in COVID, it's been, you know, there's many layers that we need to use sort of as different tools. Just because vaccines are out there doesn't mean that masks stopped working. And in fact, none of these measures are 100% safe. So, you know, I think the future that we have is a future where it's not going to be the government imposing upon you and saying you must wear masks everywhere. It's going to be more of an individual decision in a lot of ways. And people are going to have to make decisions about, well, you know, if I'm outdoors playing soccer or something, is that risky? No, it's probably not, because being outdoors we know is very, very safe. But if I'm an employee in a kitchen, in a restaurant where the ventilation is very poor, and I know there's 3 or 4 people around me that aren't vaccinated, that's a much riskier situation. And so using tools, not just using one and not the other, but using both, I think is a really good idea. And part of the reason the WHO recommended that is because we do now know that the Delta variant is twice as infectious as the original COVID that came. And just to make it this an anecdote about it, you know, the attack rate within households early on last year was about 30% or so. So you'd have, you know, a family of 10 living in one house, you'd have 3 or 4 people get infected. And what the initial outbreak in India, when it was just going really crazy over there, everybody in the house was infected. And all the physicians were saying this is unlike anything we ever saw because it was just so infectious. Everybody in the house was getting infected. And all the data has really held that up, actually. So because it is so infectious and because no vaccine is perfect, why not add 2 very, very effective interventions together to protect yourself?
Thank you. You know, still thinking around the masks and when to wear them and when you're around people who don't want to wear them. Dr. Alec, Calac, did you want to sort of respond, give any advice to people about how to work in those situations?
Sure. You know, I think Dr. Ramers was kind of getting to this, and, you know, from my perspective, you know, some people outside, currently living in Washington, D.C., are going to continue to wear masks. Others are not, and they're going to follow the guidance. And I think what I want to emphasize here is that whatever your decision is, it's your decision, and you shouldn't feel like stigmatized by wearing a mask or, you know, kind of feel like insecure in that decision, because it's not you know, necessarily to protect you, it's to protect others. And when you're out on the street or at a grocery store or some setting where you're interacting with people outside of your household, you don't know, you know, the composition of those households and the, you know, immune status of the individuals living with that person. So what I've seen a lot of actually is, now that guidance is lifting, there's a lot of kind of like in your face questions, to the point of actually getting like violent, saying, you know, why are you wearing a mask? You don't have to wear that. And actual physical altercations, and some of them actually being on tribal reservations where people are coming from off the reservation, you know, to interact with tribal businesses and saying, like, what are you doing? Like, the CDC says this, but, you know, looking to stir up controversy. So at the end of the day, you know, it's the Swiss cheese model of protection. You know, doing one thing is going to be provide its own level of effectiveness. But as you start to add layer after layer with masks and other forms of prevention, that's all the better.
I like that Swiss cheese. Dr. Lowe?
So one of the things, maybe to take it out of the more political areas, that in Asian countries, in Asian cultures, it's a lot more common to wear masks when you're in public, especially in crowded urban settings, as well as kind of the tradition that if you're not feeling well, you would wear a mask simply out of courtesy to your community, your neighbors and friends, so that you're less likely to transmit whatever disease it may be, whether it's flu, whether it's COVID or something like that. And I think putting it into more cultural context, even in California, on campuses, it can be quite common, even before the pandemic, to see Asian students wearing masks on campus. And I think it's just a part that, we have seen and maybe only attributed to, say, Asians, but it wouldn't hurt if we thought of it more as a general behavioral aspect to think about.
Yeah, that we're caring for each other and our communities. Thank you for that. So a lot of people have been asking, should our children get vaccinated? Dr. Calac?
So I'm going to just to say a couple comments, because I know Dr. Ramers has the real specific stuff on. So I'm going to set them up here right now. But the study is actually looking at children under 12. Right now, we're currently vaccinating children between 12 and 17 with Pfizer, and I know Moderna was right around the corner in requesting their ability to vaccinate this age group as well. And I know that the studies were ongoing. I think they had finished enrollment, and they're looking at my latest update was they're doing a dose response studies to look at what response would be required to provide the adequate protection with the vaccine. So I know that I've been having conversations just to kind of switch it up a little bit, and I'll let Dr. Ramers kind of give some more details about where we are with the studies. But in terms of talking to my patients, I've been having those same conversations with parents who have not been vaccinated, and making them aware that the vaccine for their infants 6 months and older will likely be available sometime at the beginning of next year. And I think it's a little more thought-provoking when they stop to consider, like, I haven't got the vaccine, but now I'm going to have to consider whether I should give it to my child or not. So it adds a different dimension in the need to protect their family, and now that it's available. So that was one component, and I just wanted to comment also briefly before I lose my train of thought, in terms of the potential for protecting our families in against a variety of ailments, whether it be MRSA, methicillin-resistant Staph aureus, on doorknobs at your favorite clinic or from a family member, or wondering why the person at the bowling alley sprays that spray in the bowling shoes after or before you use them or after you use them. Wondering about how many people really actually wash their hands after they leave the restroom. Wondering about just the flu in general, and covering your cough and washing your hands, and really looking at the context of the potential not only of other infectious disease around us on our day-to-day lives, but also how that relates to the coronavirus and the ability to protect ourselves and the ones we love with a vaccine that's highly effective and could prevent some serious illness from those in our households and those around us.
Yeah, thanks, Dan. I think one of the fundamental issues when we talk about kids and COVID is that for a long time there was false information being spread like crazy that COVID just doesn't affect children. And it really, really does. And if you look at deaths and you look at hospitalizations and you look at this syndrome, which is called MIS-C, which is a very serious condition, There have been over 15,000 children hospitalized in the United States from COVID. There have been over 300 children that have died of COVID. And there's been almost 4,000 of these cases of MIS-C, which we don't really know the long-term consequences of this. And there's also something called long COVID, where people just don't generally recover after having COVID and they have long-lasting symptoms. So I think you may know who was spreading that misinformation, but it was just completely not true that kids are not affected by COVID-19. Now, it is true they have a lower risk of dying than adults, but it's not a zero risk. And so kids are part of our community, and it's not just about getting COVID, it's also about spreading COVID. And we've seen for many months now that the groups of people that are getting cases and really perpetuating this pandemic on and on are younger people, 12 to 29 or so. And so there are many reasons that I think children still need to be vaccinated. My 13-year-old and 16-year-old children were vaccinated as soon as we possibly could, mostly because they wanted to feel less scared about it. And they wanted to get their lives back and get back to sleepovers and sports and those types of things. And they were having games canceled. I mean, I think the College Baseball World Series just had a forfeit due to COVID because one of the teams had an outbreak. So many reasons that children absolutely need to be vaccinated. I think the way that it's going to go is that slowly we're going to get down to younger ages. That's just kind of the way that they have to test vaccines because of safety. And then the last thing I'll say is that there have been concerns about safety with COVID vaccines because you're giving it to very healthy individuals. So the bar has to be extremely high. But the CDC just performed an analysis to look at these COVID vaccines and whether they're safe in adolescents aged 12 to 18. And I mean, we can show you the numbers. The vaccines, if you give 1 million vaccines, it would save thousands and thousands of hospitalizations, probably save 70 to 80 ICU stays, for a lower rate of adverse reactions to the vaccine. So when you line these things all up and you look very seriously at what the risks of the vaccinations are versus what the benefits are, the fundamental fact that COVID is not a completely benign disease in kids kind of makes it a pretty obvious choice. And that's why CDC has continued to endorse vaccination of children.
Thank you. Did you want to add to that, Alec?
Yeah, I always like to know numbers or at least be familiar with them. And I attended a town hall with officials from the CDC and the NIH about COVID-19 infections in adolescents. And while hospitalization rates overall are low, 314 deaths from COVID have been people 18 and younger. And for those who are hospitalized, a third of them required ICU admission, 5% required ventilation, and I think strikingly, 30% of those hospitalized had no underlying health conditions. So while the numbers are low, I think each individual adolescent having to be hospitalized is so, it just tugs at your heart. And on the flip side of this, and kind of thinking of where we are, in the summer, some schools, throughout Southern California and just, across the country are planning to, start the school year in like early August. And if you think of the timeline to be, fully covered by the Pfizer vaccine, for example, you kind of have to look at starting that vaccine series now rather than later if you want to meet that window.
Yeah, it's important for everyone to start, especially with the holiday coming up, thinking around 4th of July and all these other opportunities where larger groups can gather, to be thinking about our community as a whole. So there's a question in the Q&A, and I will mess this up. The participant asked, said that they received the bamlanivimab.
Bamlanivimab.
Thank you. Infusion. And does that work the same as vaccines? And why are they continuing to get long hauler symptoms?
So really good and complicated question there. The first about how it works. So what that is an example of what's called a monoclonal antibody against COVID. And these are proteins that are very similar to proteins that we all have in the millions in our blood right now, protecting us from all kinds of infections that we've had earlier in our lives or things that we've been vaccinated for. For example, if you got a tetanus vaccine and you get exposed to tetanus, you are protected from getting the disease. And I've actually personally taken care of people that unfortunately died of tetanus because they weren't vaccinated. What bamlanivimab or any of the other monoclonals do is it gives you really instant protection just from an IV infusion. It's what we call passive immunity. So you are really given immunity over a course of a half an hour, actually. It doesn't work exactly the same way as a vaccine because a vaccine kind of allows your own immune system to develop its own immunity. And so it lasts a whole lot longer. When you get one of these infusions, it's really gone by about 2.5 to 3 months after you got it. It doesn't work the same way a vaccine does because a vaccine will give you really much longer lasting immunity. The second part of the question is, this is one of the best treatments that we have for COVID-19, actually. It has to be given very early. And it's been shown to decrease the risk of being hospitalized by 70 to 80%. But it doesn't work in everyone. And the relationship between getting that treatment and whether you have long COVID is really just complicated, and we're just beginning to understand that. So we think that it might decrease the chance of having long COVID, but not in everyone. And then this is a case where the timing is absolutely critical. And just a little bit of information from our program in San Diego, we've treated about 320 people with monoclonal antibody infusions, and we've had 4 people that had to go to the hospital, which is way lower of a rate than would be expected. Usually it's about 10% or so of high-risk people that have to get hospitalized. So we're down around 1%. But of those 4 people that did have to go, they all got the treatment pretty late. So they got, 8 days after their symptoms started, 9 days after, or 10 days after. And so, the earlier the better. The earlier you have symptoms, get a test as soon as you can. Hopefully that test turns around really quickly, and then you immediately talk to your healthcare provider about what you can do for treatment. That's the best way to prevent long-term complications.
Dr. Lowe?
The other point is that depending on which monoclonal antibody you use, there's a risk that it may not have any benefit against any of the variants, because the variants change the spike protein of the virus, and the monoclonal antibody is directed against the spike protein. So if, there's one of the studies actually was withdrawn because it proved to be less effective against some of the variant viruses. And so there's a risk that in addition to the brief period where you have protection, certainly not as good as a vaccine, there's also that significant decrease in effectiveness against the variants, unlike the vaccines, which give you much better coverage even against the variants as they arise.
Thank you. One of the concerns that we keep on hearing around vaccines are that our young adults are worried about their fertility if they get the vaccine. Or I'm even wondering, we have some questions in the chat and the Q&A about parents not wanting their children to get the vaccine. I'm wondering if those are related at all, or what is sort of the response to those similar or maybe very different questions.
I'm really interested in Dan's perspective on this from the tribal communities, but the issue of whether vaccines cause infertility has been the subject of science fiction movies for a while. So people think that's the thought that's out there. And then there's a real world example with the Pfizer vaccine that I think is worth a couple minutes just to tell the story. So in Europe has an agency called the EMA, the European Medicines Association. It's the equivalent of the FDA. And they were examining all the data on Pfizer vaccines and deciding whether to approve it or not. There was a scientist who raised the idea, maybe we should wait and not approve this yet because we need more information about fertility. The EMA looked at it and they said, nope, we can't wait. We're having thousands of people die per day. The data looks really good. There's no reason to think that the vaccine would cause any trouble. The scientists raised maybe some, really distant theoretical concern that the spike protein that we've been talking about looks similar to a protein on the placenta. But there's really no basis in any studies that show that that's true. And in fact, millions of people have gotten COVID and not gone infertile. So anyway, the European Medicines Association said, no, we're going to go ahead and approve this. That petition that this guy raised was spread around the internet like crazy, and people misinterpreted it to think, well, over in Europe, they've proven that there's an infertility problem with the vaccines. It's not true at all. In fact, the vaccines have gone forward, and the CDC has been looking at women who became pregnant immediately after they got the vaccine and women who have delivered children after they've gotten the vaccine. And there is absolutely zero data to suggest that there's a problem with fertility. In fact, women that were in the clinical trials got pregnant when they weren't even trying to after getting COVID vaccine, several of them. So this is another information, as Alec had mentioned, where you see stuff on social media and the source is not good. It's not reputable. It can spread misinformation very, very quickly, sometimes faster than the actual real good information. And the actual real good information that we have, and that people like me and really everyone on the panel, it's our responsibility to study these things diligently. The actual information is very, very good for the safety of COVID vaccines in women of childbearing age. The additional piece of information that we have is that COVID can be deadly in pregnant women. There's a study out that says the mortality rate for COVID in women who are pregnant is 20 times higher than the mortality rate for women who are not pregnant. And so you put those two things together, and not only are the vaccines appearing to be safe in women of childbearing age, they do not affect fertility, but they actually can save a whole lot of death and dying and suffering in women of childbearing age. The one last thing I'll say is that on the male side of things, anytime somebody's temperature is raised from having a fever or from sitting in a hot tub, the sperm count lessens a little bit. And people said, well, if you have a COVID vaccine and then you get a fever the day after, then you're going to be infertile because of that. Well, if you go in a hot tub, your sperm count is going to be lower than that for weeks, actually. And so again, there's really not much factual basis to that idea.
Thank you, Dr. Rambers. That's I think what really relates well to the community at large, and the community, not only communities of color, but also all communities, in terms of some of the false information that's there. And I always encourage my patients to really look at, especially when they're getting vaccines, and if there's any kind of questions they have, whether it be a tetanus vaccine or it's the normal childhood vaccines, that they really look at the true information. They look at websites like the CDC, the American Academy of Pediatrics, or the Immunization Practices Committees, the ACIP, to really look at information, and definitely not take anything from Google, from TikTok, from any other type of social media platform, because that information has not been vetted. And I look at information in terms of what types of information you should believe in, and you should actually look at when making informed decisions. And informed decisions, for the public at large, but also for many communities who are isolated in rural areas, who may not have internet and rely on word of mouth, that the information and the health literacy that you really want to have in terms of making informed decisions about these important decisions regarding vaccines and your healthcare in general, needs to be on fact. And the example that I've actually been using in many different conversations is the information surrounding tattoos. And so in my community, and in many other communities, there's many clients who have tattoos. And so I really like to ask people, what is the information and the data supporting the safety of the ink that you've placed under your skin that you'll have for the rest of your life? And I looked actually at the FDA, and the FDA does not regulate the ink that people place under their skin. Actually, tattoos were considered cosmetic, or it's considered a cosmetic, but in no way is it supported to be placed under your skin to be exposing your immune system and your body to that ink for the rest of your life. And so in thinking about vaccine versus tattoos and the medical information and the importance of health literacy, it's important to make those informed decisions when moving ahead with something. In contrast to tattooing, the vaccine has been vetted hundreds of thousands times over, and now with the hundreds of millions of vaccines that have been distributed across the United States, we're no longer really in an experimental stage. It's not experimental. The reason why it was developed so quickly in a little over a year's time is because there was so many resources thrown at this problem, much more than for any other vaccine, and that is why it was manufactured so quickly, because it wasn't only one company or one scientist or a group of scientists. It was hundreds of scientists. It was tens and hundreds of companies modeling this, looking at this, testing this. So it was all hands on deck for a variety of reasons, because we were in the middle of a pandemic. So in terms of information, that information is real. That information is vetted, and it's something not that was developed quickly. It's just that it was developed with a large amount of workforce behind it.
Great. Thank you so much. Yeah, there has been so much research that even was started before the pandemic around vaccines. And so, keeping in mind where we're getting the information and who we're talking to. So, that we're almost at our time. And so we have one more question. And of course, we want to get to the drawing as well at the end. Alec, did you want to start us off with providing advice on how to talk to family members that are reluctant to get vaccinated? And then I'd like to open it up to the rest of the panelists for final thoughts.
Sure. So I think in studying vaccine hesitancy as a graduate student, it is incredibly complex. And, I try and frame it as something that is not necessarily a belief or attitude inherent to an individual, but actually the system in which they're interacting with, and that is influencing their beliefs and attitudes, be it contextual, group, or some previous emotional experiences with other vaccines that cause a bad headache, or just what you're again seeing on social media. And and having that conversation, I think it's so important to validate and acknowledge if family members concerned, but you may not be a misinformation expert, or be aware of the science or the studies and what is going on around the world. And I think the best thing you can do in that moment is refer them to your healthcare provider, or their respective healthcare provider, because that person, like Dr. Ramers or my father and others, are going through and absorbing all of this information so that they are able to have that informed conversation with you. Because from our community perspective, it is so clear the disparate impact that COVID-19 has had across Black, Latinx, Native American communities, not just in California, but across the country, with Native Americans having the highest mortality rate than any other racial or ethnic group. And when we look at vaccine coverage, some of the highest rates are among the indigenous population, and that's that's not because there was vaccine hesitancy. There certainly was in some communities, but it's that we're anti-exploitation, we're not anti-science. And when you talk to people, and if a concern is about some historical event affecting that particular community, acknowledge that that history is not going to go away, and certainly your present day reality, as we look at really just the structural and systemic racism across the country. It's a really hard time, and this is certainly a partisan or politicized moment where people are uncomfortable, and we're having a real reckoning with kind of where a country has been from its beginning. So again, complex, but please feel free to reach out to the people that you trust in your community to get more information.
Yes, thank you so much. Did anyone else want to add?
I'll just give a brief final thought, which is that, you know, as a healthcare provider and as an infectious disease doctor, I have seen firsthand so much suffering from this virus. And I think people make decisions based on what they have around them. If you ask people, do you have a friend or relative who has had COVID or who has died of COVID? And if people say, well, no, then they're more likely to just say it's not a big deal. But we live in a society where people are very compartmentalized, and you don't necessarily talk to the people that farm your food or truck it across the county or the country, or who put together the Amazon packages that you receive every day. But when you see those things up front, and when you see things like I've seen, and I've watched with my own eyes, more than 20 people die of this disease. And I now see people every day in our clinics that still have it. It's not gone away. And I see people who are suffering with long COVID, which is just a mysterious and humbling thing that the infectious disease community is reckoning with, having to admit that we don't have all the answers, and actually bringing up things like chronic fatigue and post-Lyme disease syndrome and post-mono or Epstein-Barr virus infection, that we don't have all the answers and we need to listen to our patients a little bit more. But it really is humbling, and it makes us in the community want to do something about it and want to save lives. And what Alec mentioned is that, you know, the development of these vaccines incredibly quickly by pharmaceutical companies and by government institutions, even though I believe they work so well, there's that trust issue that we need to get through, and acknowledge that you know, there have been issues with infertility in the past, historical wrongs and really terrible things that institutionalized medicine has really done with people. But you know, I would encourage the people to talk to their own providers, talk to their trusted voices in their community. When I have a patient in front of me that I've taken care of for their HIV for 10 years, and I say, I think you should be vaccinated, and they're hesitant, I say, look, I've had your best interests at the top of my mind for 10 years. You think I'm going to change my mind right now? And that's the way I approach family members who are hesitant as well, is that, you know, just leave the door open and come from a place of love. And we're trying to do this, and trying to offer this intervention to you to protect yourself and to protect your family.
Thank you. Dr. Lowe, Dr. Calac?
I'd like to echo both Alec and Dr. Raymer's points of view. And as Dr. Raymer had mentioned, he has spent his whole career, you know, caring for individuals, and I similarly have spent the last 2 decades, you know, caring for the community that I'm from, the Palma Band of Huseño Indians, as well as being a band member. So, and it's imperative that you have the opportunity to really be almost a hero, and we are. How so? Because we're social beings. We the only way we really thrived as a race is to work cooperatively and to rely on each other socially, to engage in our society, to have family units, to attend events, and those events need to continue. And the only way to really kind of continue them in an effective way is to provide a platform that is safe, that is relatively COVID-free, so we can continue to enjoy each other's company. And I'm going to break a little bit of HIPAA here as far as myself and my health status. So you know, why would you get the vaccine, Dan? And sometimes that means more to people, because I have asthma, because I had a childhood asthma back when we did not have inhalers. And that's a good example of the technology and the vaccine development. Before inhalers, I used a nasty medicine called theophylline. And I actually had my mother open up the gates to the clinic and give me a shot of epinephrine so I could continue to breathe. And so when we have advances in technology to provide vaccines to prevent us from actually suffering from an infection like COVID, we should definitely take advantage of it. I mean, this is a wonderful gift that we have in our own time. And I highly encourage everyone to seek it out and to actually heavily consider receiving the vaccine. Thank you.
I think maybe one last comment is that, you know, this is not the first pandemic, and this won't be the last. And I think this has just been much more of a close kind of event that makes us think about this and really think about how this is going to have some impact on the way we behave, the way we interact, and you know, how public events, public associations, as well as just simple preventative measures, is something that we are going to see changes in society and in the community, so that we are better prepared next time and we don't forget the lessons from the last 3 pandemics in my lifetime. So it's just, I'm hoping that this lesson will take a little bit better than the last few.
Thank you. Thank you, panelists. There are so many more questions than we have time for, so maybe we need to do this again and just keep on getting the information out there. So thank you so much. I am going to turn it over to Mona now for the next closing piece of our event.
Thank you, Dr. McMullin. So we are having the panelists choose random numbers so that we can identify the winners of our gift cards. We have 5 winners. So Jane and Olivia are going to help me match up the names to the participants. Let's see. So we have Linda P so far. And let me share my screen so you can get information while we're figuring out the numbers at the same time. Let's see, who else is a winner? Number 7. Let's see who's lucky number 7. Grace C. You would be hearing applause if we were in person. Let's see, we need 3 more numbers. And so behind you, up on the screen, you see the numbers of cases in Riverside and San Diego County, just to reinforce that we are not out of this, and you can see how the trends have really shifted from people who are older to really impacting the younger folks. So that underscores the importance of the vaccines. And we'll also show you additional resources if you're looking for more information about where to get vaccines, where to go for testing, and where to get treatment. This can all be sent to you by email as well in case you don't have a chance to jot this all down. Okay, so we have 3 more numbers. 2, 3, 4. Kathy K. Okay, and Kylie F. And Suzanne A. Those are our winners. So we'll be following up with you with more information about how to get your gift card. It will be sent to whichever email address you use to sign up for this webinar. And finally, thank you so much for attending. Here's additional information from our respective counties and our state public health department, as well as our Stop COVID-19 California website. And that's our statewide coalition of multiple partners across the state to do COVID-19 outreach. We will be posting this on YouTube and also clips of it on social media. And stay tuned if you're with whichever email you use to sign up for this webinar. We will keep you in touch with any future webinars as well. So thank you so much for attending. Please talk to your friends and family. It's important for all of us to get the vaccine. Thank you so much for your time, and we hope to see you again.